Hi, I'm Dr. Manny, and this is my blog for today. I'm very concerned about the death of a passenger on an American Airline this past few days because it brings to the attention some things that always have been bothering me about airline safety when it comes to your health. Now, the story goes that this passenger was flying from Haiti to New York, and she presented with symptoms of shortness of breath. She asked for oxygen, and from then on it became really a medical emergency. Shortly after, she complained of not being able to breathe. According to the stories in the newspapers, oxygen was delivered to her. Doctors in the flight were summoned to her help, and as well as a nurse, and they tried to resuscitate this patient. Now, the story gets confusing because according to reports in multiple newspapers, the oxygen tanks were not working, and the defibrillator that was intended to be used did not work according to the stories. Now, there's a big discrepancy because American Airlines does say that oxygen was indeed present on board and the defibrillator was working. The problem is that if you look at the rules, is that in any flight that is beyond 1 hour, whether it's domestic or international, it is required that all oxygen tanks on board be filled. It is also required that any kind of first aid kit be readily available and functional to any passenger who complains of a medical emergency. I, who have been in medical emergencies multiple times, know exactly the chaotic presentation and all the confusion that happens when somebody goes into cardiac arrest. And I always question, because I always hear the pilots say, you know, the stewardess or the pursers, however, whatever the politically correct name for flight attendants is today, is that they're here for your safety. But I question how many of those flight attendants are CPR, in other words, certified. CPR certification is a mandatory certification for those people that allegedly are being presented as there for your safety. And, you know, if you have equipment on board and you don't know how to use it, then you might as well not have any equipment on board. And, you know, an automatic defibrillator is not a simple machine to set up. It's not very confusing either, but it does take practice and it does take training. You know, I recently flew from Europe on, not in an American airline flight, but I flew on an international flight. And one of the things that happened when I got on board before the plane took off is that the captain or the head purser, if you will, of that airline identify all the doctors on board. Now, I have never seen that happen here in the U.S., where, you know, physicians like myself get asked to please come in the front and say, "Sir, you're a doctor? Yes. Are you willing to help in an emergency? Yes or no?" And, you know, there is an organized, and that's the key, there's an organized healthcare team that is identified before the flight takes off. You know, this is not like a boat, and sometimes we take this for granted. You know, many times we're on the air, and you know, we're sequestered in that cabin, and you know, we take health emergencies for granted. And I think that this brings the example that, you know, now that commercial airlines are so, you know, going to where no man has gone before type of modality, that we get organized in, you know, identifying who the healthcare team is before we take off. And it is, you know, and there is going to be an investigation both by, I'm sure, the federal agencies and by American Airlines as to whether or not these tanks were indeed full or not, and whether the defibrillator was working or not, and whether the proper protocols were, you know, were placed in on board of this flight, you know, that led to the unfortunate death of this lady. Now, the other side of the story is the big issue that I always tell, you know, travelers, and I tell patients, is before you get on a flight, if you have a medical condition, you know, think about it twice. I know sometimes things are unknown, you know, but if you have a medical condition, you have to have a medical clearance for yourself, because remember, you're limited in the amount of medical services that you're going to get. So that you have to identify whether or not you're taking medications, you brought the medications on board, whether or not you have a severe medical conditions. And doctors today, we could tell you exactly what is safe and what is not safe when it comes to your health and air travel. So you got to keep that in mind, and this is a perfect example of that. I have been in several flights in the last maybe 15 years or so where I had to go at the aid of a passenger. Some were simples, some were not that simple, where airplanes had to be landed emergently to get the passenger out of the airplane and get him to a hospital. So the message here is, air travel, yes, it's safe. Medical emergencies in flight are not simple and could be quite dangerous. I want to know what you have to say about this. Please email me or send me a video blog at askdrmanny.com.